Okay, thank you. It's like a football game. I get the 2-minute warning. Um, um, I'm actually surprised I was asked to be the one to speak on the exposure study that was done. A number of members of the committee are here in the room: Susan, Gina, Tina, and Eileen, who had to sort of make sense of it all and put all the pieces together. Continuing the discussion of the buffet, I know the members of the committee would like me to sort of characterize this as really the main course of the discussion. But I'd like to sort of think of it as the between course. Let's think of it as the sherbet. We're going to try and cleanse your palate of hazard and toxicity, and dwell for a moment on the exposure side of things. If you're a toxicologist or a risk assessor or an epidemiologist, you have an appreciation for exposure science. In fact, you might even say some of your best friends are exposure scientists. But do you ever really invite them to the buffet? That's the question. So I'm going to try and convince you they should be at the buffet table and be a critical component. I'm going to start with an anecdote from the post 9/11, that year that followed post 9/11. And a group at the EPA put together a screening tool to try and look at a list that existed on a piece of paper of some of the potential scenarios and hazards that the country faced. And they uniquely approached it. And one of the unique features of it was a significant component looking at exposure and exposure scenarios. And on the basis of that work, and they ran literally tens of thousands of scenarios, they took that list that was circulating in government, that was a classified list, and quite dramatically changed it. Because using exposure, they could strike lines through a number of the scenarios that were on that list and introduce new ones that probably merited higher consideration and preparation. It was sufficiently novel that all of a sudden the nascent Department of Homeland Security wanted to understand it. People at the White House wanted to understand it. And for many of them who were really from the toxicology side of things, as you might fully appreciate, it was eye-opening. So that was, in a way, my own grounding in the importance of exposure to the consideration of significant real-world problems. So let's go on to the study. In part driven by a hope within the agency at EPA and NIEHS that it would provide for the exposure community the same kind of guidance and catalyst that things like the Tox 21 study had done, some of the work more generally on the use of genomics in the regulatory arena. We did, as part of our charge, come up with a conceptual framework. John showed you his conceptual framework from his study, so here's our obligatory conceptual framework. And one of the other impetuses for the study and actually focuses of the study was the emergence in the recent past and continuing development of geographic information technologies, ubiquitous sensing techniques, biomonitoring, of course, we've heard that discussed already, and the modeling and information management tools, informatics. And another line that really ought to be on here and is still emerging, and just how we use it, really is all crowdsourced sorts of information that we have the potential to utilize on the exposure side. So we had a modification of the conceptual framework and tried to illustrate how those emerging technologies could affect that framework. Now, I guess the bottom line for purposes of this roundtable, I would say those emerging technologies combined with an appreciation for the power of exposure analysis and integrating those technologies, the informatics associated with them, and the new biology available to apply, really for the committee said that exposure science is a place that we might think of as an emerging frontier and one that should be focused on. One of the elements, let me see if my next slide, whoops, we went too far on that. And actually, I hope I'm not missing this slide. One of the concepts that we chose to call out really was the notion of an eco-exposome. And if I were to try and explain that as quickly as I could, I'd sort of say it's the notion that exposure, as has been discussed here already today, can no longer be thought of as a point in time or of a single stressor. It's the kind of thing that's developmental. It changes through time. It's influenced by all the other stressors affecting the organism. And so, you know, the good news is, in thinking about it, you have to know everything about everything all the time. And the bad news is you have to know everything about everything all the time. And in some sense, the committee, I think, knew that in an era of tighter and tighter budgets and more difficult time prioritizing research within agencies, the notion that there were mega projects to be pursued in exposure science would be not, you know, a lifting of the curtain for exposure science, but the dropping of the curtain. That people would say that's just too hard, that's too much. That costs too much. It's a 20-year program of trying to know everything about everything for an organism and all the organisms that affected it, because certainly we were stressing putting people in an ecological context as well. So I'm going to focus my one slide that I did myself. I'm going to sort of jump to that. For purposes of leaving a message with the roundtable, let's go back to two of the overarching research needs that the committee identified. And this is, again, sort of the notion of needing to know everything about everything for all time when considering a stressor and the stressed organism or organ or cell, while the advent of new sensing technologies and approaches to looking at information can allow this, you have to try and come to grips with it in a way that you can make progress and not just wait till you know everything about everything all the time. And so we tried to introduce a notion, and it isn't actually a big theme in the report. You won't find a super bullet someplace about it, but for where do we go from here kinds of considerations, I think the roundtable can really make a difference, because this report didn't hit with the impact that, say, toxicity testing in the 21st century did, or some of the other reports that have fomented a great deal of activity, especially on an interagency basis. So the strategy to move along in this regard really was about, okay, focus on your urgent needs of the day. Use those urgent needs of the day to develop your tools, to develop your infrastructure. And in thinking about that, the key word, it gets said a lot, but boy, if there was ever a place to underscore it, is collaboratively. There's so many places in our federal research agencies, in our private research institutions, in our public research institutions that have information that, you know, is just that. It's information in one place and not shared, and certainly not integrated. So use your issues of the moment to develop those new tools, to develop that infrastructure, and that infrastructure includes the educational infrastructure as well, to training new approaches and integrating these different tools within the singularity of an individual researcher. And then using this infrastructure, using these tools, begin to look to those environmental health related hypotheses that are the bigger questions, that are the more general questions, that are the questions that will lead us to a point where we can look at exposure science as a predictive science, not completely dissimilar from that little vignette I told you about for homeland security related research. So that's the message I leave you with when it is a report that is rich with ideas about experiments that could be done, monitoring programs that could be done on very large scales and across very diverse places, and looking at organisms through all the stages of their life with all of the stressors to the point of cumulative notion and the like. But the round table has the players in the game. The round table could be the place to catalyze a collaborative effort along the lines of, I think we thought was necessary to really achieve the promise of the exposure science and what's possible in this century. The EPA has a couple of projects that are underway now that capture that flavor. It's probably helped by the fact that Tina is now over there, helping to implement some of these programs. But that's my exhortation to the roundtable to give us a little bit of a kick in that regard. And I'm done.
So now you know why you were picked, Paul. Okay, so we're going to switch a little bit. The next presentation is not about a report per se, but it is about a conference, the Advancing the Next Generation, Next Gen of Risk Assessment Public Dialogue Conference that was held in 2011. And Isla Cote is going to be our speaker. Isla is a senior science advisor for the US EPA, the National Center for Environmental Assessment. This center is responsible for EPA's health assessments that are used to support agency decision-making. She's a board-certified toxicologist. She's worked in the area of environmental risk assessment and science policy for the last 25 years. And she's also an adjunct professor at the University of Colorado, Department of Molecular, Cellular, and Developmental Biology. With that, Isla, thank you.